These are the main 10 points. So yeah, so they don't say they must, but they use the word strongly recommend. That orthodontists be familiar with the signs and symptoms of sleep apnea, screen the patients, refer to a physician. They obviously a sleep physician or like a ENT. Over in America, they call them otolaryngologists. So pediatric patients with nasal obstruction or enlarged tonsils and adenoids, adult patients with nasal obstruction or enlarged adenoids there. They do mention as well, some forms of orthodontic treatment have been shown to be important in the treatment of sleep apnea. So I'm sure it happens a lot in Ken's clinic, happens a lot in my clinic as well. Kids get in early enough. Some of them actually had sleep apnea with evidence, with sleep studies, and then yeah, expand their jaws. Remember, the top jaw is like over 80% of the upper airway. So you make the top jaw bigger, opens up the upper airway, bring the lower jaw down and forward, opens up the lower airway so they can breathe better, sleep better. So we actually often cure kids with their sleep apnea. And an interdisciplinary approach serves in the best treatment of patients with sleep apnea. So yeah, have a read of the white paper. Let's talk about some risk factors now. Obviously older age, as you get older, the risk goes up. Plateaus at about in your 60s, 70s. Being male, if you're a male, you're 2 to 3 times more likely. A lot of it is because like we pack our weight here, stomachs in here. So if the men put on weight, we're like self-suffocating. And as we mentioned earlier this morning, your sleep position matters as well. If you're a male with a big gut, it's like weight pushing on your stomach is harder to breathe. Or the big guys, the rugby players, the gym junkies, muscle is heavy. So a lot of them actually have sleep apnea. Obviously body mass index, speaking of that, but body mass index doesn't count for elite athletes because they're full of muscles. They're all obese on that scale. There are studies that show that a 10% increase in body weight is associated with a 6-fold increase of sleep apnea. On the other hand, there are also studies that show that if you reduce your body weight by 10%, it can improve sleep by up to 30%. Craniofacial and upper airway abnormalities. So that's where we come in here because we can fix, craniofacial distortions. In particular, Asian patients, unfortunately, we're mostly Asians here, so we're mid-face deficient usually, as you know. Yeah, I pretty much tell patients that, but I don't swear, but I say, yeah, if you're Asian, you're fucked. And in my head, I'm thinking you have an airway issue unless proven otherwise.